I'm really excited today because I have a guest that's going to explain a little bit about the telehealth experience for her. And this is Flip Gray. Welcome, Flip.
Hey, thank you so much for having me.
Well, we're excited to have you. And Flip is the co-director for CFI where I work. And she's been using telehealth for her daughter, Kiara. And so, Flip, if you could give me an idea, a little bit about what the telehealth experience has been like for you.
Yeah, sure. So, when things started happening and changing really, really fast in response to the pandemic, and we started realizing that the social distancing orders and such, I needed to respond pretty quickly to the services that my daughter Kiara here was already receiving. She was in one-to-one play therapy and ABA therapy, and we realized that we weren't going to be able to go to an office or have people come into our home. And so really, from your suggestion to look into my health insurance and figure out what telehealth options there were, we were able to do that week one. And within 2 days, we had one-to-one therapy, which you'll see here, Kiara sitting outside on that blue chair doing. She's consulting with her therapist there. And then the following week, we were able to get ABA in line, and that's also when Medicaid opened up their policies and regulations for telehealth as well.
Well, I'm really glad to hear that you looked into it. That makes me happy. And tell me a little bit now, Flip, that you've tried it. What are some of the things that you like, and what are the things that you have disliked, if any?
Sure. I think one of the obvious things is we're doing this virtually, so we're not face-to-face with the person that we're working with, but it's given us a great avenue to continue, and through the relationships and collaboration with her therapists, we've really been able to make this work. So one-to-one therapy requires play, puppetry, use of toys, stories, acting back and forth and such. So instead of being in the office and using the therapist's toys and such, we compensate that in Kiara's room, which works out pretty well. And the therapist can still use some of her objects, her toys and such, across the screen. And ABA therapy is more difficult. ABA requires demands that are placed on Kiara to follow requests, to complete tasks and such like that. So we are not sitting when that is occurring. That's a lot more active. I'm running around the house with my phone, trying to keep her in screen so that the therapist can see what's going on. But it's also beneficial that at the end of both of those types of therapies, there's a parent therapist chat. So we're able to consult and talk and know what we need to practice for the rest of the week.
Well, and now that you've tried both, you've tried telehealth and in person, do you have a preference, and would you recommend it to others?
I will start off by saying I will absolutely recommend this to others. Again, it is an adjustment, but if you give it a chance, I think at least just give it a chance. And it continues the needed service at this time. I think we would be fine with the one-to-one play counseling to continue in a telehealth format, but I do look forward to the day that our ABA therapist is coming into the house.
I understand. Well, Flip, thank you so much for joining us today. I really appreciate it.
Sure. Thank you for having me.